Welcome you. We're diving straight into a topic today that's, well, it's a cornerstone of cancer care, but often flies under the radar: oral health.
Mm-hmm.
We've got a fascinating set of materials pulled from an Oncology Certificate Program for RDHs that's Registered Dental Hygienists, and it really got us thinking.
Yeah, it's quite something.
Here's this specialized training, right, designed for dental hygienists, focusing specifically on oncology. And it really points to a crucial intersection in how we look at patient well-being.
It absolutely does. What's immediately striking is that this program even exists. I mean, it signals a real and pressing need.
Exactly.
So we're going to explore why these dedicated dental hygienists are pursuing this advanced education and the unique, really vital perspective they bring to the multidisciplinary teams caring for individuals with cancer.
And I think people might be surprised by some of the direct links we'll talk about
Mhm.
between oral health and, well, the success of cancer treatment.
Definitely. And it's so relevant right now, too.
Right. With April being Head and Neck Cancer Awareness Month, this increased attention on the oral health of oncology patients couldn't be more timely.
Good point.
Okay, let's unpack this then. The program materials hit on something huge right away.
Hmm.
There's an enormous needs gap that exists in oral care for oncology patients.
Yeah, that jumps out.
It seems these patients are facing significant oral health challenges, but the very professionals who could help often need more specific training in oncology.
That's the core of it, really. It's not that these hygienists aren't skilled dental professionals. Of course they are.
No, absolutely not.
But it's about the very specific ways that cancer and its treatments can impact the mouth, and the specialized knowledge needed to effectively manage those effects.
Can you give an example?
Well, think about it. A patient undergoing aggressive chemotherapy whose mouth becomes so riddled with mucositis they can't eat or even take their oral medications.
Why, oh,
This isn't a rare occurrence, and it can directly impact their ability to complete their cancer treatment. It's serious.
that paints a stark picture. And the reasons driving these hygienists to seek this training are really revealing, aren't they?
They are.
They want to become better advocates for their oncology patients, which really speaks to their dedication, I think.
It does. It shows a real commitment.
They also want to feel truly equipped to prevent and treat the side effects of cancer treatments using the latest research, products, and technology. That proactive angle seems so essential.
It is. Prevention and early intervention are always best, aren't they? Particularly with the often severe side effects of cancer therapies.
Hmm.
Having up-to-date knowledge allows these hygienists to offer the most effective strategies right from the outset.
And another big motivator seems to be the desire to educate the medical oncology teams themselves on why a consistent oral health protocol is so vital.
Yes. That education piece is huge.
It sounds like there's a real need to kind of bridge this gap between dental and medical care in this specific context.
And precisely. The medical team is understandably primarily focused on treating the cancer itself. That's their main goal. However, neglecting oral health can lead to significant complications that can actually disrupt cancer treatment, increase the risk of serious infections, and really take a toll on the patient's overall well-being and quality of life.
So the hygienist can be that crucial educator, highlighting those connections.
Exactly. They're perfectly positioned for it.
They also express a desire to feel confident enough to reach out to their local oncology treatment centers and perhaps help develop programs or act as consultants.
That's a really proactive step, isn't it?
Yeah, towards making oral health an integral part of mainstream cancer care.
Mm-hmm.
And the goal of securing a position on an integrated care team, whether paid or voluntary, really underscores this shift towards a more comprehensive approach.
Absolutely. When you have a dedicated oral health professional as part of the core oncology team, these issues get addressed proactively and consistently.
Right.
It shifts oral care from something reactive, like dealing with a problem after it starts, to an essential component of the overall treatment strategy.
And for the hygienists themselves, I imagine this specialized training offers a way to stand out among their peers
Oh, definitely.
and feel much more prepared to work in oncology settings, whether with adults or children.
Yes, it opens up new career paths and opportunities to make a real difference in a specialized and, frankly, very important area.
That aspect of professional growth is significant.
It allows hygienists to deepen their expertise and contribute meaningfully to a very vulnerable group of patients. And the fact that the program specifically mentions preparing them for pediatric oncology, well, that highlights the extensive scope of this specialized knowledge.
We even have a testimonial here from Leslie Pryor, who described the program as very informative and appreciated that it covered pertinent information for the integration of oral and overall health.
That's great to hear. Real feedback like that really emphasizes the value of this kind of focused education.
It does. It confirms that the program is connecting with the professionals who need this knowledge.
And that they can see its direct impact on improving how they care for their patients.
Yeah. Okay, so we've covered the why, the significant need and the driving forces behind this specialized training for dental hygienists. Makes a lot of sense.
Right.
Now let's dig into the breadth of knowledge that this Oncology Certificate Program encompasses. It sounds incredibly thorough.
It truly is. The program emphasizes an in-depth review of implications cancer treatment can have on the oral cavity, and it's so important that this includes both adult and pediatric patients.
Yeah, reflecting the diverse needs within oncology care.
Exactly.
And it's not solely dental experts leading the charge, right? The program highlights that the instructors come from various realms of oncology care,
That interprofessional approach is key.
bringing together different healthcare specialties that must offer a really well-rounded and interconnected understanding.
It has to. For example, in a module about managing oral infections, you might have a dentist specializing in oral medicine collaborating with an oncologist.
Who understands the patient's specific immunosuppression risks.
Right. And maybe a nurse practitioner who manages their overall medication profile. Learning from professionals with different expertise provides a much richer understanding of the complexities involved.
And how oral health intricately connects with other aspects of care.
Precisely.
Looking at the core module topics really gives you a sense of the depth here. It kicks off with a general review of the biology of cancer and pharmacology specific to oncology patients.
Which makes sense as a foundation.
Yeah, you need that baseline understanding of the disease and its treatment.
That foundational knowledge is absolutely crucial. Understanding the underlying biology of cancer and how the specific drugs used in treatment work, and critically, their potential side effects, provides the necessary context for all the more specific oral health considerations that follow.
Then there's a module on key lab markers in oncology patients and why they matter for guiding dental treatment and communicating effectively with medical professionals.
Oh, that sounds incredibly important for seamless collaboration.
Doesn't it?
It is. Being able to understand and interpret these lab markers allows the dental hygienist to have informed conversations with the medical team
Right.
and make the right decisions regarding dental treatment, ensuring patient safety, and the best possible care. You can't just guess.
The program also delves into the components of a comprehensive oral health protocol at every stage of cancer treatment,
Yeah, that suggests a very structured and proactive approach.
integrating oral care from the moment of diagnosis all the way through survivorship, it sounds like.
Precisely. It's not just about reacting to problems as they arise. It's about implementing a proactive protocol that anticipates oral health needs and addresses them throughout the entire cancer journey.
And of course, a significant focus is on the secondary complications of cancer treatment that specifically affect the oral cavity. We know these can be quite debilitating.
They certainly can be. Issues like mucositis, that's that painful inflammation of the mouth and throat.
Right, we mentioned that.
Yeah.
Infections and osteonecrosis, which is essentially bone damage in the jaw. These can severely impact a patient's ability to eat, speak, and ultimately their quality of life.
So this module equips hygienists with the knowledge to recognize, prevent, and manage these complications effectively.
Exactly, that's the goal.
The program also includes modules on pain management and the use of specific products, even mentioning laser therapy treatment,
Interesting.
as well as auxiliary care in oncology, like nutrition and how to care for patients with laryngectomies, tracheostomies, and even those at risk for ventilator-associated pneumonia.
Wow, that last point really underscores the highly specialized nature of this training.
Doesn't it?
It does. Caring for patients with such complex medical needs requires a very specific understanding of their conditions and how oral care needs to be adapted.
And the inclusion of nutrition and airway management just shows the holistic approach.
Mm-hmm.
There's even a module dedicated to the key things to communicate to medical professionals about the importance of oral care.
Ah, back to that interprofessional understanding.
Come on.
Vital. And then, importantly, there's a section specifically focused on pediatric oncology.
Right.
covering care models, treatment approaches, medications, and how to work effectively within a team in that setting.
That pediatric focus is a really significant addition, I think. It recognizes the unique challenges and considerations when caring for children with cancer.
Yeah, the treatment protocols and potential oral complications can be different from adults, right?
Absolutely. And a family-centered approach is paramount in PEDS.
Let's explore that pediatric oncology section a bit more. It's noted as a new part of the program, and it's specifically designed to prepare hygienists for working in pediatric oncology hospital settings. That sounds like a very specialized and, gosh, deeply rewarding area of practice.
It truly is. Working in a children's oncology setting requires not only advanced clinical skills, but also a deep understanding of the unique dynamics of a pediatric hospital.
The crucial family-centered care model we just mentioned.
Yes, and the specific types of cancers and treatments that are more common in this younger population, it's a different world in many ways.
The program highlights the importance of interdisciplinary roles, which we've already touched on, but also the key differences between adult and pediatric hospitals. That emphasis on the family-centered approach is so critical in pediatrics, isn't it?
Absolutely. In pediatric care, the family isn't just visiting, they're an integral part of the entire care team.
Right.
So knowing how to communicate effectively and sensitively with both the child and their family, and how to support their emotional needs is just as crucial as the technical aspects of providing care.
That makes sense. They also address hospital-acquired infections and how oral health plays a role,
Wow, a major concern.
especially for pediatric oncology patients who often have weakened immune systems.
Preventing those infections is a top priority in these vulnerable young patients, and bacteria from the mouth can be a significant source of systemic infections. It's a known pathway.
And the modules cover specific pediatric cancers, the structured chemotherapy treatment plans, or roadmaps as they call them, and even bone marrow transplants.
Right, HSCT, hematopoietic stem cell transplants.
Along with the very specific oral health considerations for each of these situations.
Yeah, understanding those specific chemo schedules and the impact of bone marrow transplants on oral health allows hygienists to provide very targeted and effective care. It's highly individualized.
I see they also incorporate case studies to really solidify understanding.
Which is such a valuable way to learn, right? Connecting theoretical knowledge to real-world patient scenarios.
Definitely. And the instructors for these pediatric modules, Catherine Martinez and Lynette Acosta, both have impressive and really relevant backgrounds.
Yes, Catherine Martinez brings her extensive experience as an oral health educator within a hospital setting and her work in public health.
So a broad perspective.
Exactly, on how to best integrate oral health into overall medical care. And Lynette Acosta, with her background in pediatric hematology-oncology nursing, provides those crucial insights into the medical aspects of caring for these young patients.
So their combined expertise ensures a really comprehensive learning experience.
You'd think so, yeah.
The course descriptions and objectives for their modules sound incredibly focused, covering everything from the different roles within a multidisciplinary oncology team to the unique aspects of pediatric healthcare environments, infection prevention strategies, common pediatric cancers, and that HSCT process and the specific oral health considerations involved.
Precisely. Their aim seems to be equipping hygienists with a thorough understanding of the entire landscape of pediatric oncology care.
So they can confidently and effectively contribute as valuable members of the healthcare team.
Yes. And the inclusion of the HSCT process is particularly important, as those patients often face significant and complex oral health challenges. It's a tough road.
It's really remarkable to see the depth of expertise that the instructors in this program bring across all the modules, not just pediatrics.
Agree.
Let's touch on some of the other key areas they cover. Dr. Karen Clark, for instance, leads the module on the fundamental biology of cancer.
Right. Dr. Clark's module provides that essential groundwork, clearly differentiating between benign and malignant tumors, and exploring the origins of cancer, including the genetic factors involved and the influence of environmental and host factors.
That foundational understanding is key, isn't it? To grasp why cancer treatments have the effects they do throughout the body, including the oral cavity.
Exactly. It all starts there.
Then we have Katie Charles with the module on understanding lab work and its interprofessional implications.
Ah, the labs.
I noticed she has an upcoming section specifically on the care of immunocompromised patients who require mechanical ventilation and tracheostomies,
Wow, very specific.
with a strong emphasis on preventing ventilator-associated pneumonia and educating caregivers. That's a very specific and critically important area of focus.
It is. In severely immunocompromised oncology patients, these life support measures are sometimes necessary, and maintaining meticulous oral hygiene is absolutely paramount.
To prevent serious complications.
Exactly. Potentially life-threatening complications like ventilator-associated pneumonia or VAP. The dental hygienist's role in this aspect of care is often underestimated, but incredibly vital.
Elizabeth Jenks leads a two-part course on pharmacology for the oncology patient.
Right.
Given her personal experience with cancer, her insights into the different types of drugs, how they work, and their potential adverse effects on the oral cavity, things like osteonecrosis, mucositis, fungal infections, herpetic lesions,
The list goes on.
must be particularly impactful and relatable.
Absolutely. Her personal journey undoubtedly adds a unique and deeply empathetic dimension to her teaching, understanding not only the scientific aspects of these drugs, but also the real-world impact of their side effects on oral health is invaluable for hygienists caring for these patients. And she also covers the pharmaceutical treatments used to manage these oral complications.
So what helps? Zach Kaisberg's nutrition module addresses dietary recommendations during treatment, how diet can help manage side effects, the important role of nutrition support, and even preventative dietary habits.
Nutrition is such a critical component, isn't it? Especially for individuals undergoing demanding cancer therapy.
It feels central.
It is. Maintaining adequate nutrition is absolutely crucial for patients to tolerate their treatment, manage the often debilitating side effects, and support their overall recovery.
And the dental hygienist can play a key role there.
They can, yeah.
Hmm.
In identifying potential nutritional challenges related to the mouth difficulty, chewing, swallowing, taste changes, and collaborating with dietitians to ensure patients receive the appropriate guidance and support.
Jennifer Brown's course focuses on the initial assessment of an oncology patient,
Okay, the starting point.
covering the key components of that assessment, tailored oral health regimens for different treatments like radiation, chemotherapy, bone marrow transplant.
So specific plans based on treatment type.
Exactly. And how these assessments and regimens fit into the workflows of an interdisciplinary team. Her experience at Cardi Cancer Center must provide really valuable, real-world perspectives.
No doubt. Her direct experience within a dedicated cancer center setting allows her to provide very practical guidance on how to conduct thorough initial oral health assessments and how to seamlessly integrate oral health care into the patient's overall treatment plan. Understanding the specific nuances of different cancer therapies is essential.
Dr. Megan Reuter and Jill Meyer-Lippert collaborate on modules that cover secondary complications in detail.
The side effects again.
They delve into osteonecrosis, various types of infections, bacterial, fungal, viral trismus. That's the difficulty opening the jaw.
Lockjaw, basically.
Yeah. And oral mucositis. Addressing the underlying causes, symptoms, how to prevent and manage these issues, and the necessary modifications to oral hygiene practices and product recommendations.
That's a lot to cover.
And Jill Meyer-Lippert's specific focus on side effect support is particularly relevant here, obviously.
This comprehensive approach to managing secondary complications is absolutely vital. Oral mucositis, for example, is so common and often very debilitating.
Yeah.
And having a deep understanding of its nuances, along with other potential complications, allows hygienists to implement targeted preventative and therapeutic strategies. It can significantly improve patient comfort and outcomes.
Sarah Jane Snyder's module introduces photobiomodulation, or PBM.
PBM. Tell me more.
Well, think of them like using specific light wavelengths to promote healing. For managing oral mucositis and other challenging side effects like oral graft versus host disease, GVHD, radiation-induced trismus, and xerostomia, that persistent dry mouth.
So low-level laser therapy, sometimes called cold laser?
Exactly. It's fascinating to see the integration of this kind of advanced technology in support of cancer care.
PBM has shown significant promise in reducing the severity and duration of oral mucositis and other oral complications. Understanding how this technology works and when it can be most effectively applied provides another valuable tool in the hygienist's toolkit.
Definitely adds another dimension. Finally, Roxanne Susan Norwood's course addresses the crucial aspects of oral care extending beyond active cancer therapy.
Survivorship care. Important.
Emphasizing the need for individualized approaches, appropriate follow-up intervals, and the ongoing importance of collaboration with the oncology team for both short-term and long-term considerations.
Because oral health needs certainly continue after treatment ends.
They don't just stop.
Exactly. Oral health isn't just a concern during the period of active treatment. It remains incredibly important throughout the survivorship phase. This module highlights the need for continued monitoring and tailored care plans to address potential long-term effects.
and ensure ongoing well-being. So after completing a program like this, what's the overarching goal? It sounds like it's ultimately about significantly improving patient care
Yes,
and fostering much stronger interprofessional collaboration.
that's precisely the aim. The program is designed to build confidence in dental hygienists to provide exceptional care for oncology patients, to effectively educate their medical colleagues on the critical importance of oral health, and to actively participate as valued members of integrated healthcare teams.
Catherine Martinez's statement in the program materials really encapsulates this, doesn't it? She stresses that dental hygienists bring absolutely vital knowledge to medical settings
And they do.
and encourages them to confidently step into these roles to enhance patient care and educate medical teams.
Yeah.
It's about recognizing and embracing the value of their specialized expertise.
Yes, her point about hygienists sometimes questioning their place or their value within medical settings is a really important one to acknowledge. It underscores the need for specialized programs like this to not only impart the necessary knowledge and skills, but also to empower these dedicated professionals.
To advocate for their role and contribute their expertise with confidence.
Exactly.
And the program materials clearly outline how this specialized knowledge can be directly applied, right? In both traditional dental practice settings and within cancer treatment facilities.
The practical application.
From conducting thorough pre-treatment oral health assessments and providing essential patient education,
Crucial steps.
to effectively managing those challenging treatment side effects, collaborating seamlessly with the medical staff, and even assisting in the development of vital hospital-wide oral health protocols.
It's all about being proactive and fully integrated into the care team.
It truly is, ensuring that oral health becomes a consistently recognized and highly valued component of comprehensive cancer care.
Which ultimately leads to significantly better outcomes and an improved overall quality of life for patients navigating this challenging journey. That's the bottom line.
So as we bring this deep dive to a close, the key takeaway really is the profound and, like we said at the start, often underestimated importance of having specialized oral health knowledge as a fundamental part of the comprehensive care provided to cancer patients.
Absolutely. By thoroughly understanding the potential oral complications that can arise from cancer therapies,
Right.
and by recognizing the critical role of proactive dental hygiene interventions, oncology teams can significantly improve patient outcomes, substantially reduce the risk of serious infections, and greatly enhance their overall quality of life.
It really makes you consider just how interconnected all the different facets of our health truly are. This isn't just about teeth and gums in isolation.
Not at all.
It's about the whole person and their experience throughout a very demanding and often difficult time in their lives.
It does, and it raises a really interesting question for you, our listener.
Yeah.
How does gaining this understanding shift your own perspective on healthcare? And the potential for different specialists to collaborate even more effectively to deliver truly holistic and patient-centered care. What could that look like?
That's a fantastic point to contemplate. If this deep dive into the crucial role of oral health in oncology has sparked your curiosity, you might find it valuable to explore more about Head and Neck Cancer Awareness Month
Good idea.
and the growing movement to more fully integrate oral health professionals into multidisciplinary medical teams. It's a truly fascinating and increasingly vital area within the broader healthcare landscape.